Okay. Hello. Hi. So we're on YouTube and on Instagram as well now. So
Which camera am I looking
I
into
guess
now?
both. Just
Glad I'm not a politician, just two cameras.
just flick between the two. So
Okay.
I asked for some questions to be sent in beforehand, and we did get a few. And I know today we were going to be talking about lip lifting and hairline surgery as well, which are pretty hot for you right now. So
Yeah.
I thought maybe we could just do a question or two first, and then go straight in.
Sure.
So she asked whether or not, in your opinion, Botox for the neck, does it ever work, or do they have to just have a neck lift?
Well, I love the question because basically we are asking if I want to get from A to B, do I always need to take a plane? It really depends where A and B is, and this is what your neck looks like. And there are things we can achieve with Botox, like some bands, and these bands usually start appearing anywhere in your late 30s, sometimes a little bit earlier when you are very, very thin. And it's a muscle. It's called platysma, and whenever we make this, we have these kind of muscle tightened, and we can create these bands, and these bands can be nicely treated with some Botox. Now, anything else apart from these bands is a volume issue or a skin issue. Skin issue in terms of aging. So, some treatments can be non-surgical, like laser treatments or radiofrequency treatments just to tighten the skin. Or if the skin is just too loose because you've been adoring the sun for 40 odd years and you've been a heavy smoker, well, the radiofrequency and some Botox will just not, do the cut. So, well, pun intended, you need surgery for that. Or if you have a heavy neck, there can be volume issues in terms of fat. We have two different layers of fat. The superficial layer of fat is just under the platysma, which can be sculpted with some liposuction, for instance. And then there is a deep layer. And sometimes I see young men, in their early 30s, and they're ripped and they're working out, and they still have this kind of fat neck because they say, I just can't get rid of it. And this is the deep fat, which only can be done by a deep neck lift. So it really depends what your anatomy is and what you're looking for. And you have to assess the skin, the muscle, the fat underneath, and obviously the goals that you're looking for to achieve.
Very comprehensive answer. Thank you. The second question that we had was about fat, actually. And they were asking, if you were going to do fat transfer to the face, where's your favorite place to harvest the fat from?
My favorite place to harvest fat from is actually the lower part of the belly, so underneath, the belly button. This is a good area. If this is not available because people are too thin, you might go on the thighs. The fat there is a little bit different in its consistency. So my favorite place certainly is the belly button, also because you make a small incision inside the belly button so you don't see it after it's healed.
And just talking about fat as well, how would you be cleaning that? What's your preferred method?
Well, there are various options and various protocols. There used to be the whole thing about spinning, etc. Nowadays, you don't really have to do it anymore because we did the research and saw that it doesn't really have to be this, machine invasive or machine intensive separation. So what you do is you harvest your fat first, and then you just let it rest. And once it rests, the fat obviously, just like in a soup, the fat goes up and the liquid portion is on the bottom. So you can separate it, and you do it twice, and then you start filtering it through a small cannula between two syringes. And this is the way you can break it down. And then depending how many passes you do, you can have microfat, which is a little bit smaller, or you can have nanofat, which is much, much smaller. And the smaller the particles, the better it is in terms of creating smooth contours. But also, the more you break it down, you are breaking down cells. So there is also a risk that you are actually destroying viable tissue. And this is something a lot of people forget is whenever you do fat transfer, not all the fat that you transfer will actually survive. This is a free graft. Okay, so let's say somebody has a skin cancer. We remove the skin cancer on the face, and I take some skin behind the ear and cover it up. It's a free graft, so it has to grow into the tissue that is surrounding it, and the same with the fat. So if you do that, it'll take some time, and about 30 to 40%, depending on which area, is not going to survive. Meaning, you always have to overcorrect initially to make sure that everything heals.
Totally. You've just got a question there about hair transplant. I know that's not exactly what we were going to talk about.
Look at me. I tried everything. It doesn't work.
So why don't we go on then with that nice segue to talk about your hairline lowering, which is something which is quite hot at the moment. I've seen a few pictures of that on Instagram. Are a lot of people doing it these days, or is this a new thing?
No, it's not a new thing at all. It's been out there for at least 20, 30 years, easily. The thing is, it's just like with a lip lift, I guess. A lot of people don't do it because, it's a long incision here in the lip lift. You have the incision in the center of the face underneath the nose. And people are kind of scared to create a very, very visible, unsightly scar. So really the trick is, you have to get a good scar. Are there a lot of people doing it? No. And we get a lot of requests from all across Europe, UK, US, Bahrain, like various continents even. And I'm not super aggressive on marketing either. So it is a big deal. And, I made the joke with hair transplants in my head, but it's a joke for a guy, because it's okay to be bald for a guy, but it's such a burden in our society for a woman to have any kind of hair loss issues or even just a high hairline. Wow. So a lot of these patients, and I have to tell you, it's turning into one of my favorite surgeries, and not so much for the surgical intricacies, but for the change you can have on someone's life. And initially I was a little bit confused, but about 50% of our patients, so when you have surgery, 4 hours after surgery, we do remove the bandages. And they look into the mirror, and 50% of our patients cry. Wow. And initially I thought, like, was it that much, did I mess it up? Or no, it's just like people are so happy. And I mean, it gives me goosebumps just talking about it. I'll never forget one lady, she was in her 50s. She cried before the surgery, on the day of surgery, and afterwards. And she said, I've been waiting 35 years for this moment. So, a lot of people underestimate what it can mean to a woman to have a very high forehead.
Where's the scar for that?
Where is the scar? Okay, so basically how it works is we use the hairline as you have, and we make an incision just across there. And then there are 3 different ways I can, work on the sides, working on new techniques right now. That's the benefit of Corona. You're sitting at home and having time to think. And basically you resect a strip of skin just above in front of your hairline, and you have to move all the hair-bearing skin from your scalp to the front. So initially the scar is in front of your hairline, and we are working right now on some new techniques how we can even hide it even better.
Amazing. Sabzi, who asked that question on Instagram about hair transplants.
I come to you right now.
I do have a hair transplant surgeon coming on the stream. I do have a hair transplant surgeon coming on the stream. I think maybe next week sometime, so maybe you could rejoin us then, Sabzi. Somebody's asked you a question on YouTube regarding facial feminization. If you do it, and if so, what's the most popular procedure and what's your personal favorite?
I don't do facial feminization. I work with a surgeon. We work in the same building, and Chris Inglefield, he does a lot of that. He is running the London Transgender Clinic, so he might be the guy you want to talk to. But I don't do any facial feminization. Now, there is a lot of hairline lowering, obviously, in the facial feminization as well, because guys have a higher forehead, and then you want to bring it down to make it more feminine. But this is all Chris's field, and he is the expert there, and he has the experience over, many, many years. Yeah. So that's where he's the man.
I love his accent. He's got that really charming accent. Where's he from again? Trinidad or somewhere like that?
Thank you. Understood. Yeah. The German has no fine accent. He's from Trinidad. Let's make it very short. Gotta go.
Yeah.
Yeah, he is from Trinidad.
Yeah, it's such a cute accent, isn't it? Also, regarding then the lip lifting, I get a lot of patients coming in who have a very, very long philtrum. And they always ask me, can you do something with this with fillers? And I say, look, okay, we can do something, but
What do you
Well,
do?
sometimes you can rotate the lip slightly using filler, but I think if it's too long, you just have to make an incision. You have to cut it, because otherwise it just looks weird. And having seen some of the lip lifts that you do, the result is fantastic. Really, it takes years off. It looks amazing. But I always get patients asking me, how is it done? Like, literally, how do you do it? Do you cut the muscle? Do you just cut the skin? And I never know the answer. So maybe you can tell me.
Yeah, of course. No, thank you. I'm happy to. So the lip lift is actually a procedure that was first introduced to the world in the 70s. And back then, facelifts became popular, and surgeons realized, okay, we can rejuvenate the face in a certain degree, but we can't do anything around the eyes, and we can't do anything around the mouth. And this is why you have upper and lower eyelid surgery, and then they came up with the lip lift. Why is that important? As we age, this distance, and I call this the white lip, and then there's the red upper lip. So the white lip is getting longer and longer. And the longer this gets, the shorter or less volume we have in the top lip. And because of the elongation, we also cover our teeth. So if you look at the smile of a grandma, assuming she has still teeth, the teeth are always covered up, and you have a lovely smile. I can see your teeth right now. So my subconsciousness is more connected to your smile because it's an open smile. Now, if I smile like this, it looks like I'm hiding something or I'm lacking teeth. So it's also a lot of psychology that plays into the perception of aesthetics. We did an interview. No, not an interview. Sorry. We did some research last year. We interviewed 1,400 people. And basically what we did is we analyzed this area. We had two identical pictures, like you picture right now. And what we did is we took away the philtrum with just this kind of shadow creation in the middle. Everything else was identical. Just these two shadows were gone. And the data showed that people prefer aesthetically the philtrum. So this is super important. And the philtrum disappears as we age. People also thought that the face without the philtrum looked a little older, even though everything was identical. And the third thing is people thought it also looks more masculine. Mm-hmm. So all features that play into, aging of a face. Now, how is the surgery performed? It is surgery by an incision. And it's, when you're sitting in front of a mirror, you will see that you have a bit of a shadow right under your nose. And we use this natural shadow to hide the scar. Anywhere we have a transition, just like with the hairline lowering between hair-bearing skin and no skin, it's always easier to hide a scar where we have a transition between either hair and skin or light shadow and dark shadow. So we use this area here to hide the scar. And we measure beforehand how much skin has to be resected, similar to this, strip resection up there. And the traditional or old technique would be just pull up the skin. Now that doesn't really do the cut, and it can create really unsightly visible scars. So in order to make it, better, what we basically developed, I call this the biplanar lip lift. We worked in two different planes, and as I resect the piece of skin, I then mobilize the deep tissue, similar like a facelift, where you don't pull on the skin, you pull on the deep tissue under the skin to lift the volume and, to restore the volume in the face. So similar here, I'm pulling on the deep tissue that is connected to the muscles, not cutting the muscles. And then as I lift this up, the skin is following already. So there is less tension on the skin. And without the tension on the skin, there is going to be a better scar. A little trick that I added to the whole, that's like the secret sauce. At the end of the surgery, especially in young patients where the muscle around the mouth is stronger, I inject a little bit of Botox. Now the Botox weakens the muscle of the mouth, so this kind of movement, which is pulling on the scar, is reduced. This lasts for 3 months, as you well know, and this is the key healing time for the scar. So within these, we have different techniques to get a good lift and equally reduce the tension on the skin.
How do you know exactly how much tissue it is that you're going to take away?
That's a good question. So it's a super simple way to simulate the result of a lip lift with 2 cotton buds or Q-tips at home. You basically have to have dry skin, and you put them underneath your nose and you start rolling. And by rolling them, you simulate the lift of the lip, and you simulate the increase of the red lip and the shortening here. And I see how much of a lift I have in terms of how much teeth I see more. Let's say you don't have any tooth show, and I lift it up by 4 millimeters. I know that a minimum of 4 millimeters of skin has to be resected to get this kind of a lift.
Got a fan there on Instagram.
Do
Yeah,
I?
you can see.
Oh, Ben from Beverly Hills. Well, Ben is really, really, really the man on the West Coast for lip lifts. And yeah, he is the real deal over here, man.
We just had
That's funny.
a question on YouTube, actually, just going back to your earlier comment about doing Botox. Robbie saying, so are you saying that Botox would help with the banding or ring around my neck? I'm thin with no extra weight. I'm guessing so from...
The Botox helps with the platysmal base, but yeah.
Yeah.
So, these kind of lines that you have, sometimes they show up. It's a big deal, and it's like one of the, tricky parts if you do neck lift surgery to get rid of them, because obviously you're working on the muscles. But if this is the only concern you have, Botox is the first thing you want to do. I miss you too, Ben.
So in terms of popularity,
Really,
is that something that you're doing like every day these days? Are a lot of people having it done?
Pretty much both surgeries, the hairline lowering and the lip lift, are procedures that I see inquiries coming in. Certainly on a weekly basis. I wouldn't go that far and say on a daily basis, but at least 2 to 3 days every week. We do hairline lowerings every Tuesday. So, people, and with a lip lift, it's the same thing. I mean, I'm very sorry to say, because, it's a little bit counteractive to what you do as a filler doctor, or a doctor using fillers, but not everybody benefits just from the filler. And, sometimes people come to see me and say, okay, I want to have it lifted, but then it has to be this precise shape. And I say, okay, in that case, you need a lip lift, but then you will also need to have fillers, because fillers are dominant and much better in terms of precision. That's for sure. But if you really want to restore, the anatomy that you have, or recreate the anatomy, sometimes surgery is superior. So I'm not saying that everybody should have a lip lift, not at all. But some people, as you say, especially when you have a very, very long lip, if you do too much filler, it just looks too heavy, and then they look sad or pouting, and it's just like, whereas when you restore it, it's a whole different ball game. And with the new techniques, because I mentioned the philtrum, with the new techniques, we can also increase the appearance of the philtrum.
Yeah, I totally agree with you. So are you doing the filler afterwards?
Yes, if a patient wants to have this kind of, precise, defined look, I tell her we have to wait at least 4 to 6 weeks, because initially you do have some swelling. Downtime of a lip lift is about 1 week to 10 days of swelling. There's a garment company in the UK, Lipoelastics, maybe you know them. They approached me and we created a face mask or garment for lip lifts, which can be also combined when you have a facelift, so you have the same. And this basically kind of reduces the overall swelling. And we then, remove the sutures on day 6. I tell everybody take a week off from work, and the redness of the scar prevails anywhere between 8 weeks to 3 months on an average. Just like with the hairline lowering scar, these are scars that tend to last, the redness lasts for a while. There are ways and tricks you can cover it up with makeup without interfering the healing process. But this is something everybody has to understand, that, it takes a bit of time.
So something that I often see in the clinic, completely unrelated topic, patients, they go and have a facelift, or they have a facelift and they come in and say, oh, it was good, but I've still got this here. I've still got this wattle underneath my neck.
Yep.
And I don't know whether or not that's something which is unique to my particular patient cohort, or is it something that we're just seeing over here, or is that common?
I think it has to do with the deep tissue, the deep layer of fat that I was talking about. It requires a little bit of, I'm an ENT surgeon, head neck surgeon, and then I did facial plastics. So I have enough experience in reconstruction and cancer surgery in the deep neck. So obviously the anatomy is familiar to us, but there are people that haven't done a lot of anatomy in that area. And it can get scary because you have, big arteries and veins. So some people might try to avoid this, and this could be the reason. Now, anybody who had a neck lift, let's say 3 to 8 weeks after this, still can have a little bit of fullness here because of the swelling. So don't be, frustrated in the first 2 to 3, even 4 months. Some people just heal very slowly, But if this is something you see after a year or two, maybe it's just the fat tissue in the deep area that needs to be reduced in volume. And to do this, you have to do it surgically, so you actually see it. You can't just do liposuction because of all the, you have salivary glands, you have facial arteries. Like, you have to be aware of where you are, and you just can't go in there blind and just do some liposuction.
So it's more surgical technique rather than the pre-existing anatomy. Interesting. 'Cause,
both. I mean, you have the anatomy, but you didn't do the right technique. That's what it is, I think.
I see that a whole bunch. Yeah, I do. And I get a lot of...
And you know what? The test for it is quite simple. I mean, you can test it, next time you see one of these patients. And as I said, let's give them half a year of healing. But if you grab the kind of tissue underneath here and you swallow and it just like sticks in your finger, this is the kind of subplatysmal fat, so the superficial fat. Now, if it's just even deeper, nothing changes. So by the test of letting someone swallow, and if it's just like slides out of your finger, it's subplatysmal fat that is actually the issue. And if it's deeper than that, then it's the deep fat that needs to be taken care of.
I have that. That's a great test.
We all do, but the question is how much.
That's a great test. I'm gonna do that. I'm gonna suggest that. Something else that people ask me, because I refer patients for facelift surgery if I think that they're not going to get a good result with me, and that they always ask me. I don't know why they ask me, like, ask the surgeon, but they always ask me about scarring now, because I think that we've all got this image in our head about having this huge scar that is going to be very visible, especially if somebody's wearing their hair up, for example. Have there been any advances in scarring?
Yep.
Or scar position, I should say.
Oh yeah, big time. And also in terms, yeah, absolutely. I mean, the scar positioning, the initial first famous surgeon for facelift surgery was actually a surgeon in Paris, and it was a she. And back then, basically what she did, she would just resect a bit of skin here and pull it up, and a bit of skin here and pull it up. And people would do it before they go to a party. Wow. Because they could cover it up with their hair. So this was the real lunch lift back then, okay? Now, taking this away, let's say the full facelift, basically what we do is we place the scar around the area of the hair, if someone has hair. And again, just like here, we use the transition between skin and hair to hide it. It then goes into the triangle above the ear, and there's a change in quality of skin between your cheek and your ear. So right here, we're just going to go around this top part of your ear. We then place, there's this little piece of cartilage covering your ear canal. We place the rest of the incision behind it, and then it goes around your earlobe, and the rest is covered up behind again. And it depends really on how much work we need to do on the neck, if we have to extend the scar into the hair-bearing skin, or if we just leave it behind the ear.
And another thing that...
So if you want to take a...
No, it's okay.
Go ahead. So, if you think about it, it's going to be about 1 centimeter or 2 centimeters around the hair, then 1 centimeter in the top part, and one line just around the earlobe. And usually people, who are seeking a facelift, when it's not just a young person who wants to change the volume in the face, these people have these kind of small creases in front of their cheek anyway. So you're using these kind of natural transitions to hide things.
People, again, often ask me how long a facelift lasts for. How often do you have to do it?
It really depends on what. Yeah, every year. No, just kidding. It really depends on. It really depends on the technique again. I mean. I spent a fair amount of time with a good friend of mine in New York, and this is because my wife was from New York, so every time I would see her, I actually, instead of looking at the Statue of Liberty, I would visit Andrew Giacono, and he taught me to do the deep plane facelift, which is a technique, people would say a little bit more advanced in terms of surgical technique, but the results last more because you're actually moving all the tissue. The simple rule of thumb really is a short surgery with little invasive doesn't change a lot of anatomy, so you can't really expect the longevity of a result. So anybody who's giving you, lunchtime lift of 1 hour, well, it's going to last for 1 or 2 years. But, if you have something that's going to take a little bit longer, you obviously restore more volume, more anatomy, and thus therefore the result is better. My lip lift takes about 45 minutes. I know guys that do 20-minute lip lifts, but they just pull on the skin. So it's always the kind of, how much work do you put in?
His before and afters on Instagram are really something. Dr. Jacono's,
yeah, he's not really doing well he's not helping our profession, because nobody's as good as he is.
I mean, some of them are just outrageous.
But he is a good friend of mine. He's really good. I mean, he's been doing it for 15 years, and now he's really, really, really fast. But it's because he's been doing it for so long. I remember we were both invited to a conference in Russia, and he was performing live surgery where, he's in a theater and it's a transmission to the lecture hall, and they're watching it like, people would go to watch the movies. And I remember that people in the audience were complaining that there was some kind of a glitch because his instruments were moving so fast. No, that was real time. I mean, he's really good.
That's amazing. Yeah, I've got myself...
but it takes 15 years of making.
Yeah, well, practice makes perfect. I'm fully intending to have that done for my 40th, which is in 18 months' time. So watch here for me aging in reverse soon.
You don't look like 40, by the way.
Oh, it's the lighting. I've got this amazing ring light that's just, blurring the heck out of everything on my face. I wanted to talk to you as well about your rhinoplasty, because I know you're using the piezo for that, which is something that I was familiar with from my dental work originally. And I didn't know that you could actually use it for that.
Yeah. So, correct.
Maybe for people who don't know what the piezo is, perhaps you could go into some detail.
Yeah. 100%. So, rhinoplasty very often includes working on the nasal bone. And the traditional way of doing it is you have a chisel and some rasps and a chisel and a hammer. Now, this can be precise if the chisel is sharp, but nevertheless, it's still quite traumatic. And therefore, they basically stole the principle of piezo surgery from dentistry, and they introduced it into rhinoplasty maybe about 8 or 9 years ago. And piezo basically is a crystal. It's a piezoelectric effect. That's what it's called. And it's a crystal that changes its shape if you apply energy, electric current to it. So it becomes bigger or smaller. And piezo is used, for instance, when you are... and the other thing is, if you change its shape by compressing it, for instance, it creates electric current. So it goes in both ways. So piezo is used when you go into the room and you clap, and just the sound wave can be enough to create a change in the shape of the crystal, and it turns on the light. Equally, Saturday Night Fever, when you're dancing on the floor and it changes the colors, this is piezo. And in the surgery that we use, we have this kind of a pen. And just like in casinos, they're stacked up. There's a pile of these piezo crystals, and electric current is coming in, and it creates this kind of microscopic vibration, invisible to the naked eye. And what it does is anything hard, like bone, can be cut precisely, and anything soft just absorbs the energy and creates heat. So if I would just hold it onto my finger, it would burn my finger because of the heat, and this is why there's always a little fountain of water, irrigating the area to cool it. But basically, if I would want to, I could write my name into your nasal bone because it's that precise, which is impossible with, chisel and hammer. I have a video on my YouTube channel explaining the whole thing, or on my website. So anybody who's interested, just go and check it out. It is basically you can cut a raw egg, the shell of a raw egg with it, because anything inside just absorbs the energy, whereas the egg shell, which is hard, can be cut.
I didn't know.
So it's very delicate. And the reason we use it is I
didn't know that you had a YouTube channel.
Yes, well, sometimes I'm a little bit working, just a bit. So a couple of weeks ago, it's nothing in comparison to you, and I've just learned that my videos are far too short. But I'm not doing it to get gain a lot of followers on YouTube. I'm making these short FAQ videos so people just watch them and get a quick insight into a certain procedure.
I didn't realize. Okay.
And the piezo video is 2 minutes, which is probably the longest video.
Okay. Well, anyway, we'll link it maybe on the YouTube channel underneath, so if people want to see they can always just go over to your channel. I'm taking it that you've never written your name in anybody's nose before.
Nobody really. No.
There was
no. There are, it does a lot.
There was a dentist who actually got struck off for doing that. He used to carve his initials in the amalgams as the amalgams were setting. This is a few years ago now, yeah, but it was a thing, yeah. Oh, somebody just asked if doing a lip lift is something appropriate for men.
Yes, and I do have about 5 to 10%, depending on the year, of male population asking for lip lifts. Because, it's the same thing. If it's long, if you don't see your teeth, it's an aesthetic issue. The question that men always, the issue with men is, as you see right now, I'm having this beard called Corona. So people who are having a beard or, any kind of, you make sure that if you do the resection, you don't want to end up with the beard hair growing out of your nose. So as we do the lift, I actually have to burn some of the follicles from the from the inside to make sure that there's like 0.5 millimeter of strip of no hair underneath the scar, so it still looks natural. But this is something we can do. Yeah.
So presumably, if you're doing that technique, it has to be an open rhinoplasty, right?
For the lip lift of a guy?
No, going back to what you were saying before. Sorry, I'm jumping around a little bit about the piezo.
Gee, it feels like a medical exam here. I don't even understand the topic.
We were talking about the piezo before.
Yes, very good question. Yes. Thank you for reminding. No, it's correct. So, there was a lot of, so basically the whole idea or the history of opening up the nose, and I'm not going to bore anyone with this kind of issues, but it took about 100 years of medical or surgical history between opening up the nose as we do right now and making the first incision here, because everybody was afraid, well, if we cut here, it's going to, destroy the blood vessels and the nose will die and it's going to all be black and fall off. So it takes years and years and years. And we created, not me, but I know the guys who did. It was Dr. Olivier Jabot from Paris and Milos Kovacevic from Hamburg, who I know quite well. They created something they called the extend open approach. So open approach means we make an incision here and lift the skin. And the extended open approach means we release everything all the way to the side of the nose so that we can actually see where we cut with the piezo. And you have to do it under, well, it's advised to do it under the open approach, not closed, because as I said, you create heat. There are surgeons that do it in the closed approach. I just don't feel comfortable because you create heat and you potentially can burn tissue from the inside.
So are you doing every rhinoplasty open?
I would say 98%.
Really?
I'm obsessed. I mean, I spoke to a couple of guys with, at the moment, nobody is in the office. And I spoke with a couple of guys also in the US, and it looks like facial plastic surgeons have some similarities in terms of, trying to be competitive, trying to be ahead of the game, a lot of OCD. So if you do rhinoplasty, you are ahead of the OCD game. You really want to control symmetries because it's such a complex surgery. And therefore, the open approach to me allows me not only to feel it, but also to see it. Because one issue that we are always fighting against in rhinoplasty, which makes it so tricky, is the moment you start surgery, there is a bit of swelling. And the swelling makes it very difficult to anticipate the outcome if you can't really, rely also on the eye rather than just the feel.
Somebody's just asked on Instagram, what's the scarring like with the open rhinoplasty? Which is a good question.
It's a lovely question. Best answer for that is go on my Instagram. I have a couple of close-ups. If you do it the way, again, no tension should be there. It's really, you will know that there is a scar because you know where to look for. But the goal really always is, if somebody is sitting, let's say, 3 feet apart from you or in front of you at work, and they don't know where to look for a scar, they shouldn't see one. And this is what you can get. I mean, I'm very diligent telling patients what they have to do for the first 3 months on a daily basis. And, you know, they get a whole guide of what to do and not to do. And taking care of the scar is very important because, you know, no matter how good the result is, just like with a facelift, if the scar is still visible, it's not a good result. I did my PhD in scars, so again, you know, a bit of OCD there, and I want to make sure that people get the best scar they can.
Okay, tell us about that. That's interesting.
I know the English think I'm blowing my trumpet, but
no, it's interesting.
no, well, it was very boring.
No, come on, we want to
know. So this is back then. I was okay. Thank you. I did my work on keloids. This is a specific type of scar. I mean, there are like 5 different types of scars, and you know, scar is never skin. That's the important thing. If you want to learn quickly a little bit about scar, let's start about this layers of skin. We have a top layer and a bottom layer. The top layer always heals without scarring. This is called the epidermis. So if you scratch your skin, there's a little bit of bleeding, like, you know, beginnings to skateboard or any of that. It's just a bit of bleeding. It's the epidermis, and these cells melt without scarring. It's the deep tissue, the dermis, which is made by fibroblasts, that create this kind of reparative or restorative tissue, which is like concrete, and this is the scar tissue. So ideally, a scar looks almost like skin in terms of color and level, but it's not, because there are no sweat glands, there's no hair coming out of it, so it's always just something similar to skin, but a scar is never skin. And then there are 5 different types of scar. You know, the normal scar, it can be an ice pick or an atrophic scar that goes inside, like anybody who had like to deal with acne, they know that they have these kind of, you know, indentations in their skin. And on the other scope, you can have a hypertrophic scar, so a scar that is very, very raised. And a lot of people have it, for instance, anywhere where there's a bit of tension, like on the elbows. And the extreme of these bad scars, rather than a hypertrophic scar, is the keloid. Now, the keloid is a scar that never stops growing. It's really the sphinx in kind of healing or skin healing medicine, because the biggest keloid described in literature was after a vaccination of a child. A guy comes a couple of years later, let's say 10, 15 years later, and he had a scar of a keloid the size of a football on his arm.
Wow.
This was somewhere in Africa. Gosh. So, you know, what we know is keloids are scars. We have to have a trauma to the skin, to the deep tissue, so the dermis. So these fibroblasts, I compare them with Hulk. Once you irritate them, and there are areas in the face and on the body which are easily irritatable, and others are not. Once you irritate a keloid-prone person, so it's the DNA of this person that really decides it, these scars just explode and they continue growing, and it's very, very hard to deal with them. And the darker your skin type, like African descended or, you know, Oriental, these people are more likely to have it than pale people. Yeah. And, you know, I get a lot of questions like after nose job, after lip lift, after Helen Lauren, can I get a scar which is a keloid there? No, none of these have ever had a keloid scar in the literature described. Other areas, like around the jawline, even after otoplasty, when you just like, you know, correct protruding ears, they can create big scars. So my work was really in the lab looking into the proteins that are changing and different. And I'm not going to go down that rabbit hole, then we're going to lose all followers. And then also, like a clinical, we created a treatment to take care of these kind of scars so that people have less likelihood of a reappearance after years.
Wow, that's really interesting. So is this something that you're treating?
You know, every now and then people are still coming to me. Yes, if need be, yes. It's tricky because there's only so much we can do here in a private medical setting, really aggressive scars. So with keloids, you have to start sometimes something what we call the multi-treatment approach. And so it's not just surgery. If you resect the keloid, it'll come back 100%. If you combine a resection of a keloid with injection of steroids, which is, you know, a cortisone, which reduces the aggressive behavior of the fibroblasts, the likelihood of a recurrence is just 50%. If you combine it with pressure, which we created, you know, we had this team and we developed these kind of pressure devices that kind of put pressure on the scar afterwards, it's even better. Very, very aggressive scars come back, and sometimes we have to do radiotherapy, just like with cancer, just to like try to kill the fibroblasts. And you know, some of this can be done in private settings. Sometimes you have to go into the hospital, which is obviously the NHS in the UK.
Wow, that is intense. Really intense.
It is, and it's very frustrating because very often it's, you know, kids, etc.
Yeah, really. What about a hypertrophic scar? Somebody asked on Instagram if you could get rid of those.
Yeah, that's the other thing. Yes, you can. There are two different ways of dealing with this. Hypertrophic is the fourth one, which I didn't mention. So the atrophic is, you know, very, very thin, and hypertrophic is like usually there is a lack of stability, and it's also a little bit of an indentation. So if it's a small hypertrophic scar, which we just had in our office, what we do then is we kind of release the scar from the deeper tissue, and you do this by taking just a needle, because, you know, for injections, because the tip of the needle is always a little bit, it looks like a small knife, so it's the smallest knife you can have. So without creating any scars on the outside, you just pinch the skin and you cut the underneath of the scar so it's not indented anymore. And then, depending on the preference of the patient, you can either use dermal fillers and, you know, have a series of dermal fillers to lift it up, or you do it with fat. The alternative to this is, depending on how big the scar is, you just resect the entire scar and cut it out and redo it.
Different topic. Sorry, somebody asked on YouTube. They're only 19, but considering getting a facelift, my face overall just looks better when using face tapes. So I feel like I'd be satisfied by getting a permanent lift. Can you be too young for this?
You know, I'm always careful with major invasive procedures which really change the whole appearance of a face in a young age. So from a psychological point of view, you have to be, you know, careful and never feel rushed in this, and also be very, very careful. Why do you think it makes you look better? I'm not saying that everybody is having, you know, coming from the point of, oh, somebody said something negative and I feel bullied and this is why I have to take care of it. But there are a few patients that had this kind of, you know, experience at some point, and this leaves a kind of self-consciousness which is not driven by your own motivation. So this is something carefully to be explored. And quite frankly, anyone at that age, I would always consider, let's do a bit of fillers first, which gives you a direction where we can go, because filler can be dissolved if you don't like it, rather than having surgery and you wake up and you have issues with, you know, not liking the result, or even worse, you can't identify who you are in the mirror anymore. There are people that can benefit from a facelift, but I would say you have to be at least in your late 20s, early 30s for a facelift, just because there's a little bit of, you know, aging happening already. So for a 19-year-old, I think the safer way to go would certainly be the fillers. I don't know about you. Me personally, I don't do threads, so this is obviously another option. If you know someone who's good at threads, you could try some threads, but I would always try to be minimally invasive at that age.
I used to do them, and then the CQC changed the regulation, so now it has to take place in a minor surgical room, which we don't have that facility, so I don't do threads anymore. And actually, even when I was doing threads, I'm not sure. I would normally pass everybody over for surgery, unless it was to do the just the monofilament threads for skin textural improvement, because I still feel like they work quite well. But for the suspension threads, not sure about that anymore.
Well, that's exactly why I don't do it, because if you look at the before and afters of threads, you know, you never really see a result where you say like, wow, this is really something. And certainly you don't see long-time results of threads, you know, like they're always immediate, but nobody's posting results, let's say 2 months afterwards. So that's why I don't do threads.
And the downtime as well that the patient goes through for them, it can be quite significant. And by the time that you've done that, I just feel like, you know, why don't you just have the surgery? If you need the lifting that badly, just do the surgery. And I think maybe for somebody who's young, they might work, but the way that they were kind of being sold, I feel like they were being really oversold, which obviously leads to huge amount of disappointment, because if somebody's a surgical candidate and then, you know, they're having some threads put in and it doesn't last, of course they're going to be disappointed, having gone through all that pain and expense to get to that point.
I agree.
Great question from Julia there about tear-trough and malar edema. Any surgical options?
There are surgical options for the tear-trough, obviously, depending on how much it is. Again, the very, very minimally invasive first step would be just to do some dermal fillers. If you want to do the surgical route, there are various techniques, and it really depends on the fat. So our eyeball is within the cavity of the skull, surrounded with fat. And again, some people just by aging, some people by their DNA, this fat is protruding and it creates this kind of a tear-trough, the shadow underneath. So in a younger patient, and this is anything up to, let's say, 45, sometimes just reduction of the fat, reducing the volume, can already even things out. And sometimes what we also can do with the lower lid blepharoplasty is we make an incision, and depending, we can do it on the outside or even from the inside, so there is no scar. And we can release this fat and basically place it over the bone. So basically fill the tear-trough with the fat. And we suture it to the deep tissue so it just stays there. And this is another way that we can cover up these kind of tear-troughs and fill them out. The malar edema is a tricky one. It really is a tricky one. There are various approaches with lasers and surgeries. We still haven't nailed it, and we are still trying to figure out to what degree it really can be treated. I mean, you have some experience with this as well, and you work in a laser place. So what is your take on that?
Yeah, I always say, no, I'm sorry, there's not much that we can do. Sometimes you can do skin tightening treatments. That might help a little bit, but not really. You're always going to have it. And people often ask me whether or not you can put filler to try and disguise it. In my experience, actually, it just makes it look worse because it's hydrophilic, so it's going to be absorbing water, and it can make the area look even more puffy, unfortunately. Somebody...
and a lot of...
No, it's okay.
Go ahead. A lot of patients with these kind of, puffy areas here, just to have a better understanding how sensitive this area is, go to a restaurant, have a very, very heavily salted dinner, like go to a tapas bar, have 2 glasses of red wine, and then look at this in the next morning, and you will see how much puffier this is, So it's just an area in your face that has the higher tendency to retain the water. And there is no treatment that I know that really sells the result well to say, okay, this is reliable for everyone.
Somebody asked on Instagram about options for hooded eyes on a 40-year-old, the least invasive and the longest lasting effect.
The least invasive is a headstand. Okay. So there are three. Terrible. I know. Sorry. This quarantine thing doesn't do good. I need to talk to normal people again. Okay. Hooded eyes can be caused by either, again, a lot of volume in the upper eyelid, which is the fat protruding, or it can also be this kind of heaviness that comes from above. And, as we age, the eyebrows come lower. So sometimes just by lifting the eyebrows, this is already what you need to do to release the kind of fullness and heaviness. Like if I push on my eyebrows, obviously I can almost close my eyes just by pushing my eyebrows down. So having a brow lift done, it can already release the whole fullness that you have there. This is something that, if it's just a little bit of footing, you can try with either filler or Botox or both. My personal understanding or my experience with filler is, it depends really on the three-dimensional contour of the bone, if the filler can really lift it well or not. If you want to do it really well, you make a small incision on the sides. It's a surgery which takes about 25 minutes on each side, the most, and you can actually raise the tail of the eyebrows. And we have changed a lot in terms of brow lifts. There were like 6-7 different techniques. Nowadays, we basically just focus on raising the tail of the eyebrow, because this is the part that gives you this kind of rejuvenated, fresh appearance, and equally takes away the fullness there. And if there's a lot of fat in the upper eyelid, you do an incision, just in the crease, And you can, again, resculpt it or reduce it and play around with it to make it younger. The other way that people can end up with a hooded eyelid is if there's a loss of volume and then they are just like sunken in. This can be the consequence of an over generous initial upper blepharoplasty, upper eyelid surgery, where they took out too much fat and then suddenly they're sunken in because some, young eyes are with volume. You have wonderfully young eyes because there's volume. If I take out all the fat in your upper eyelids, you're going to look terribly old because they are sunken in. So this, again, could be an indication for fat injection, dermal fillers, or you have to do a little bit more, if possible, and reposition the fat if there is enough fat to be repositioned.
This brow lifting that you're talking about, this seems to be something that's quite trendy in the celebrity world at the moment. Everybody's asking at the moment for this sort of what's her name?
Can't talk about it. Yeah. Sorry, can't talk about it.
You know who we're talking about. This. They all want this.
No, I'm joking.
Oh my god, I can't remember her name now. That Kardashian or that Jenner, I'm not sure which one it is. And also Ariana Grande as well. She looks like her brows are in a slightly different position. So it looks like that's something that people are doing at a very young age now.
Yeah. It's again, there was a study published by the American Academy of Facial Plastic Surgery, I think 3 or 4 years ago, which said that, more people in their 20s are seeking facial plastic surgery and non-surgical treatments. And we coined it the Kardashian effect because of the selfie mania. So nowadays, you see all this, and, there are selfies, and then there are selfies with a little bit of editing. But basically what it does, it lowers the threshold to get these kind of treatments in younger patients. And we all know the effect. If you, me, and someone else would be standing on a parking lot looking into the sky, there's a very high likelihood that anybody passing us is going to look up. So there's this kind of crowd phenomenon. And also in aesthetics, This is why I started my Greater Beauty podcast, and you were going to be one of my people on the show talking about this. But what I'm saying is there is this trend right now. Now, what we did in terms of analysis and understanding aesthetics, the tail of your eyebrow, we separate the eyebrow into 3 parts: the head, the body, and the tail. And the tail is the part that is going down. And every eyebrow looks a little bit different. Basically, you can have a bow, or you can have this kind of a V shape. But the tail of the eyebrow and the elevation here, this is the part that makes the best result. Initially, we would raise everything, but this gives you this kind of surprised look, or please, asking for mercy if it's done badly. But this gives you a little bit more of a dramatized, feminized, vamp style. It just has a little bit more oomph to it.
It's sexy, right?
It is. That's it. I mean, some shapes just add on to sexiness. Just like, shortening this here gives you changes the whole perspective of your lower third of the face. Just the same here, Some tweakments, really surgical tweakments, can really increase the overall perception. And, coming back to the hairline lowering, this is why it's so super powerful, because, you lower it by a few centimeters here, but it changes the whole perception of your face. Because if you shorten England by a few miles, the whole map is changed. The whole contour. So the same with with any of these procedures. Yeah, they can be done in a nice way, and they are very powerful.
Someone's just asked about your opinion on a brow pexy versus a brow lift.
Well, it's just, it really depends on what you want. Brow pexy means you make a small incision and you just lift it up there. It depends on the anatomy. It depends on the skin. I had a patient, she wanted a brow lift, but she had a very, very high hairline, and we wouldn't end up, with nice, with covered scars in the hair. So I did a direct brow lift just above the edge of the eyebrow, which is a little bit more challenging. But if done right, it's fine. It really is, you have to find a surgeon that is comfortable with what he's offering, and he knows what he's doing, and he knows what he has to do if, I wouldn't say complications, because medicine is always a variety of result options, and it depends on how you heal, obviously on the skill set, etc. But you have to have somebody who knows what he's doing, and then it doesn't really matter what technique he or she will use to get you to the result, because at the end of the day, you are asking for a result, or as close to the result that you're hoping for. And I know surgeons that were, tremendously successful doing one technique, and then they completely change the game and do something opposite right now in the same area because they think now it's just better for them. So there is not one way, as they say, there is not just one way to Rome.
I think we're going to get cut off in a minute because Instagram Live only lets you talk for an hour. But there's one more question. What would you advise for eye fat protrusion?
Eye fat protrusion is when the fat is coming out. And this is, again, something where if it's just a little bit, you can think of doing a little bit of filler to just kind of blend it in. So the indentation underneath the eye fat protrusion is being lifted with the filler. And if not, then you have to reduce the overall fat around the eyes. And this is done by upper and lower eyelid surgery.
Something somebody told me a while ago was they're preferring to just reposition where the fat is rather than remove it. Opinion?
Yep. Again, depends on the anatomy. If you have a lot of fat, you have to do sometimes both. Reduce the overall fat, and you don't have to cut it out. You can, there are different ways of reducing the fat volume and remove it as well, reposition it as well, just as I explained. It really depends on how deep is your tear trough. If it's just the upper lid, you want to, you can reposition it to a certain degree, but you can do both. You can do one or the other. It really depends. If it's a young patient with a lot of fat around, reduction would be better.
Yeah.
You have to look into all, like how high is the cheek volume, how high are the eyebrows. Like it's not just this fat that you look in as a surgeon for facial plastics. You look always for the areas.
Perfect. Okay. Well, we're just coming up to the hour, so I guess that's it. Thank you so much for joining us. Can't believe we.
Thank you so much for having me.
We really got into it there, didn't we?
Thanks for everybody.
Like a whole hour.
Yeah, it was good.
Brilliant. Okay, so
Thanks,
I look forward to speaking to you at some point in the future because I'm sure that there's a whole bunch of questions going to come in after this.
Same.
Yeah, cool. I'll see you later.
Great. Happy to answer them. Thank you very much. Bye-bye.